Welcome everyone. Today's video is to show how useful ultrasound is to diagnose the involvement of nerves in leprosy. Leprosy is a very common infective cause of neuropathy, and nerve thickening is one of the hallmark signs of leprosy. So this makes it necessary to have a tool to diagnose and detect early nerve damage, especially when it is subclinical. Now, ultrasonography is a very non invasive and cost effective modality to study nerve changes, and improved image quality, portability, and reductions in price will make it possible for it to become a tool that can be used in countries, especially where leprosy is endemic. And it is used to calculate the cross sectional area and to study the changes anatomically of peripheral nerves. So, what are the nerve changes that happen in leprosy? So, there is axonal atrophy due to the hypophosphorylation of the nerve protein. This results in inflammation around the infection, and then there is a vascular port for the entry of the M. leprae from perineurium, which is outside, to endoneurium, which is inside the nerve. And then there are a lot of chemicals that are released, such as toll-like receptors and nitrotyrosin and TGF beta and matrix metalloproteases, all of which results in transient pressure variations within the nerve, leading to ischemia and reperfusion injury. So the objective of using ultrasound in the study was to compare the nerve dimensions in patients suffering from leprosy and to compare them with healthy controls. So we examined 210 nerve points in 35 patients and 180 points in 30 controls. They were examined clinically, and after that ultrasound of these nerves were done using a 7 to 10 Hz linear transducer probe. And the bilateral ulnar, median and common peroneal nerves were examined, and they were looked for thickness as well as other features like inflammation, loss of fascicles, and hypoecosity of the nerves. Our results showed that majority of patients, around 50% of our patients, were aged between 30 to 50 years, and most of our patients were male, around 74 patients. So we used relatively newer patients who were diagnosed with the disease. So around 50% of our patients were diagnosed with leprosy less than 6 months ago. Now, coming to clinical findings, 86 nerves were found thickened clinically out of our 35 patients, and 26, that is 30% of the patients, had grade 1 or asymmetric thickness, and 55% of our patients had rope-like thickness, and 14% had nodular or beaded thickness. This is an image showing the great auricular nerve of one of our patients. Here we see the common peroneal nerve, which branches off into its two branches, superficial and deep peroneal nerves. Now, coming to findings of tenderness, around 30% had no tenderness, 38% had tenderness and they complained of it when asked for. Around 19% of our patients winced on palpation, and around 11% withdrew the limb on palpation, which elicited severe tenderness. So out of these 210 nerve points, 86 were found to be thickened and 138 were found to be thickened on ultrasound. So that gives us a clinical average of 2.8 thickened nerves per person, whereas on ultrasound it was an average of 3.9 nerves per person. In all our 6 nerves, that is the bilateral ulnar, right and left, median, as well as common peroneal, it was significantly thicker in our patients when compared to the controls, and most of the p-values and all the p-values that we see here are significant. And we have also shown the number of patients as well as controls with thickened nerves, and there was a significant difference that was noted. So the sensitivity of ultrasonography over clinical examination was also been supported by other studies, and careful testing can only detect the presence of neuropathy, which indicates that there already is a substantial amount of nerve damage. However, high resolution sonography is used to demonstrate even subclinical nerve enlargement and inflammation. On comparing it with another study, it was similar to find that focal nerve thickening was the most common finding on ultrasound, followed by hypoacousis and loss of fascicular pattern in our patients. Fusiform thickening and nerve fibrosis were newer findings and seen in zero point 0.3 and 0.1 of our patients. All the thickened nerves showed an increase in vascularity on Doppler, and there was also a higher ratio of cross-sectional width and height, which was closer to 1, and just indicates that thickened nerves appear more rounded. Here we have an image of a normal nerve which shows a bundle of straws or fascicles within. This, on the other hand, is a thickened and inflamed nerve which is more rounded in contour that we see, with also increased vascular signals on Doppler mode, which is seen on the inset. Now, this is a longitudinal view of one of the nerves examined and found thickened clinically, and it shows hypoacousis with fusiform enlargement on longitudinal section. This is another thickened nerve with hypoacousis that we see, and increased vascular signals on Doppler, and some fibrous septae are also visible within the nerve, which is indicative of fibrosis on long-standing inflammation. To arrive at cutoff values of how thick the nerve needs to be, beyond which we can call it as being thickened, we have used the receiver operator characteristics and arrived at cutoff values. So here we see that most of the cutoff values for each of the nerves lie between 0.08 to 0.10 centimeter square, with a fair amount of sensitivity and specificity. So here we have indications of how sensitive and how specific we can be with establishment of each of the cutoff values. Coming to limitations, lack of a gold standard for better comparison, like a nerve conduction study per se, is one of the drawbacks of this study. And training dermatologists in this regard and accessibility of facility of ultrasound are matters that need to be addressed, especially in resource poor countries. And follow-up of the nerve changes while the patient is on treatment could further contribute to our knowledge on this aspect. To conclude, ultrasound is an objective marker of nerve thickening and leprosy, and it is an important modality in diagnosis of conditions, especially pure neural Hansen's with smear negativity, which warrants immediate treatment. These are the references we've used for our studies. Thank you very much for joining us today.